going to be demonstrating an NG tube insertion. So when you walk into the patient's room, you want to make sure that you gel in, hand hygiene. Okay, and you want to introduce yourself to your patient while putting on gloves. Hi, Lindy. Hi, Mrs. Walters. I'm going to be taking care of you. I'm your student nurse today, and I will be doing an NG tube insertion. Is that okay?
Yes, ma'am.
All right, awesome.
Nice to meet you.
So you want to make sure that your patient/client is in the high Fowler's position when you're inserting the NG tube. Okay, so to start off, you want to have the client put their head in a high hyperextended position, and you're going to check the nares. Okay, and that's good. After that, you're going to check the length of the NG tube. This is to make sure you don't go too far, make sure you go far enough. So you're going to start at the tip of the nose. Sorry, I'm trying to make it easier. And then you're going to do the tip of the earlobe. And then you're going to go down to the xiphoid, tip of the xiphoid. So it's going to be about right there. And you want to make sure you tape this. That way you know where to stop and how far to go. Okay? And then you're going to lubricate the tip of the tube. I'm not going to open it, but you'll make sure to lubricate it. Here for after everything. Okay. So make sure it's lubricated, and you're have them hyperextend their head once again. And then you're going to put the tip of the tube inside the nose, and you're going to use a downward motion until you get to the neck, to the throat. Have them open their throat, okay, and they're going to start gagging and choking. You're going to ask the patient to take a sip of water and swallow, and while they're doing that, you're going to keep pressing down until the tube stops. Right there. Okay. And then you want to make sure to check the placement of the tube. And you either do that by an x-ray, or you're going to do it by check the aspirate stomach contents. Check for acid pH, either from a 1 to 5. You also want to check if there's any equilibrium in the presence, because if not, then it means that it is zero, that it's in the lungs. Sorry. Okay, so then you're going to tape it. And it's pretty much like a pant leg.
It's okay.
Wrap it around.
A little tickly. Sorry.
And then you're going to tape, put the tape at the bridge of the nose and tape to the tube. That way it does not move. All right. Oh, that'll work. Okay. And then you want to clamp. This is so hard about it being in there. There we go, just got to work. And then you're going to clamp the tube to the gown. And then you're going to also clamp this to the food source. And that's how you do an NG tube insertion.